particularly to the young, particularly to the old. And so it's the right thing to do. We hope that what they've seen in the Southern Hemisphere, some countries in Southern Hemisphere where they've already had the flu season, that the wearing of the mask cut down the spread of that, but we don't know. The other thing that we are looking at, I have a working group, and we've not talked about this, I don't think, but I put a working group together to look at what our director, DRC, was talking about, what Annette was talking about, and that is ventilation. And, what we do in our public buildings and what we can do as people move back inside, and they're inside virtually all the time. The importance of that ventilation being right, bringing in outside air, making sure you have the right filters in place. All of those things are very, very important. And we do have, we had an expert from Ohio State who was talked a week or so ago here, and we're consulting with him, and we're going to continue to work on that. So that's another thing that we're working on as we move into the colder weather in Ohio.
Next question is from Max Philby at the Columbus Dispatch.
Hey, Governor.
Max.
So it sounds like that May was one of the deadliest months for opioid overdoses in Ohio. And moving forward, I'm just curious, what will your administration be doing to try to curb that and make sure that we don't see another record month here before the end of the year?
Yeah, we're putting a real focus with Director Chris on that and on mental health. Many times those are connected. We know that there's been a lot of downsides to this COVID besides the COVID. And one of the downsides is an increase in mental health. We're again working with the state legislature, and I hope to have some announcement coming shortly, in regard to mental health and more that we can do in this area to help our colleges, our universities, to help our high schools, our grade schools. I mean, fortunately, our K through 12 schools have wellness dollars that the legislature set aside. We worked with the legislature, and they did that. So those wellness dollars can be used in regard to mental health. But it's something we're very aware of. We're seeing it out in the communities. Getting more dollars out to the local communities is something that's very important. So we'll have more to announce in the next several weeks.
Next question is from Ben Schwartz at WCPO in Cincinnati.
Hey, Ben.
Hi, Governor. I'm wondering if you've at all considered loosening truancy laws in Ohio schools, or possibly requiring districts with kids who are feeling ill to offer the option of virtual learning whenever they need, just so kids don't necessarily, so kids who don't necessarily know if they have COVID-19 but might feel ill don't potentially spread the virus at school.
Well, that's an excellent question. We really want to encourage schools to do that. And if we're starting to get into a problem, I'm sure the schools are going to tell us, because in regard to absentee, and there's something that we need to do at the state level in regard to that. But by and large, we leave this up to the local schools. Again, if there's guidelines or if there are regulations that we need to change because of the COVID that's causing that kind of problem, then we're certainly willing to take a look at that, because we don't want children who don't feel good coming to class. And I know that schools that have done the hybrid, one of the things that they can do, or most of them I think can do, is make that switch a little easier back and forth. And hybrid means a lot of different things to a lot of different schools, but some schools, child's on for a couple of days, off for a couple of days, but they get used to using that remote learning. So again, I think those schools probably have an easier time to make that transition, but we're open to doing anything we need to do to help them.
Next question is from Kenny Bass at WCHS in Charleston, West Virginia.
Hi, Governor. We've seen in our state and obviously in Eastern Kentucky and Southern Ohio that a one-size-fits-all approach doesn't really work when dealing with COVID. So can you communicate to the people who live in our region, which is rural and in many ways much more similar to Kentucky and West Virginia than some of your more metropolitan areas like Cincinnati, Cleveland, Athens, Akron, et cetera, the differences in governing this thing in those areas and the challenges the state is going through to try to be as effective as possible in these vastly different communities?
Well, one of the great things about Ohio is we have many different communities. We have our Appalachian communities, we have our cities, we have our suburbs, all kinds of different parts of Ohio. And, I've traveled Ohio, and my wife Fran has quite a bit in the last 30 or 40 years. So we get it. We get the difference. I think when you're talking about a small rural county, we still have some counties that don't have a lot of spread. One of the reasons we put this list up on the board with 88 counties, we can kind of see, everybody can look and see what their spread is in their county. On Thursday, in fact, we're going to put some more data up. We're going to put for the month of September, how many people have been coming out with cases, that actual number, what the number is of hospitalizations so far, what the number of deaths are. And so we're going to try to continue to give people information. So I would say, anyone who's in your viewing area should try to continue to drill down on what's going on in their county and how many cases they've had and what kind of report. And we have the virus everywhere, so you can't hide from it. But there's certainly some counties in Southeast Ohio, for example, that are not as high as many of our other counties are. But I think people need to look at their own individual county. Wearing the mask, whether you're in a rural county or an urban county, is just a way to dramatically slow this. So if you're in a county where you don't have a lot of spread yet, you can keep it away. I mean, it's pretty simple. 80-90% of the people wear a mask. You're going to keep it away. You're going to keep it way, 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 way down. And it's so much easier to keep it down than when it gets up to here and it's spreading out like that. And that's a problem. So that would be my message. Wear a mask, keep it down, keep a distance. I think that's the best way to deal with it.
Governor, next question is the last question for today, and it belongs to Shane Stegmiller of Hannah News Service.
Good afternoon, Governor. How are you doing?
Shane.
The legislature sent you House Bill 242, which prohibits local governments from placing taxes on containers such as single-use plastic bags. You've expressed concerns about it in the past. Just wanted to see what your thoughts are on the bill currently and going forward, because I believe it's just a temporary ban.
Yes, this is a temporary ban, and I will sign the bill because it's temporary and because I think you can make an argument for it during the COVID period. It covers, for example, styrofoam, people carry out food, et cetera. So it's not just the paper bags. My general principle is that unless there's a compelling reason why we need uniformity throughout the state of Ohio, that we should stay away from telling local units of government what to do. They're elected by the local citizens. They should be accountable to the local citizens. If the local citizens don't like what they're doing, they can get rid of them. So if something, unless there's a compelling reason to do it, I would normally veto this bill. But we are in the COVID period. I think it makes sense during this period of time to have that uniformity and that assurance that people have this ability to use styrofoam containers to have carry out food and to use the plastic bags. So I will sign the bill, but when I get another bill in a year or so like that, I probably won't sign it. I'm told that we are done, and so let me just do something kind of fun. I want to spotlight really some everyday heroes. You know them, they're out there. Maybe you're one of them, but you probably see them every day. And they're doing the best they can to get us through this pandemic. Some of them are shining light for others. We call them heroes of hope. Here's one that we'd like you to meet. Abdul Ali, he is a hiring recruiter for Kroger. in Columbus at their brewery district store. He has hired 190 people since the start of the pandemic. These are essential workers on the front line, and we thank them for their service. Let's take a look.
Hello, how you doing today, ma'am? Pretty good, thank you. My name is Abdul Ali, and I just love helping people. I'm a master store recruiter for Kroger, located in the Brewery District, Columbus, Ohio. How's your day going today? What I really love about being a store recruiter is knowing that I can change someone's life in a second. And just knowing that I have the ability to say, hey, you got a job? We hired about 109 people since the pandemic hit. Most of the applicants that I have employed were unemployed due to the pandemic, which was some of the main reasons why, Kroger was an option for them, because the other companies that they were working for, as far as restaurants, maybe bars, salons, had to close due to the pandemic. I just appreciate and I value how much of a family that we are and how strong we are together during this tough time, because we all are scared. We're still afraid. But I know in my role, I wake up every day and I tell myself, Abdul, you have a job to do. And there are people out there who are relying on you that need jobs. Hey guys, how you doing? I'm here to help you out a little bit. There's not a lot of places that are hiring. And I'm just fortunate that Kroger itself, especially being an essential business, we're able to not only provide the community with the essentials that they need, but also we're able to employ people as well during this time. Ohioans are strong, courageous, and just fearless. Hi, Jamie, how are you? Hi, not bad. How are you today? Good. And just seeing that empowers me. We have to stick together and we have to be strong to make it through this. Thank you, sir. Have a good day. And I also have faith and belief in the fact that we will come out stronger. Thank you, sir. Have a good day.
Well, we thank Abdul. We thank all our frontline heroes. We'll see you all on Thursday. Good luck to the Indians tonight. Go Reds tomorrow.